Good evening, everyone. Thank you so much for coming. We are so excited to have you all join us in our student panel. We'll be talking about what it's like to be a medical student and bring you along on all of the fun adventures that we've gotten to do. We have four wonderful panelists, one from each year of medical school, and then myself and Claudia, who are medical students as well, will be moderating this panel for you guys. Briefly to introduce myself, my name is Leanne. I am a third-year medical student at Vanderbilt, originally from Salt Lake City, Utah, and I am planning to go into anesthesiology. And I will have Claudia introduce herself.
Sorry, we'll try again. Sorry. Hey, everyone. My name's Claudia. Like Leanne said, I'm a second-year medical student at the University of South Alabama. I'm originally from Huntsville, Alabama, and I'm still undecided in what I want to do with my future medical career, but open to a lot of options. I'm going to give it back to Leanne, and she's going to introduce our first panelist.
Perfect. Thanks so much, Claudia. So the format of this panel, first we'll go through each year. We have one panelist from each year, like I said. We'll let them introduce themselves. They'll talk about the things that they do on a daily basis, things that they wish they knew going in, anything they would have done differently, and advice for all of you guys who are going to be starting on this journey soon, hopefully. So our first panelist, this is Isaac. He is a first-year medical student, and I will let you introduce yourself, Isaac.
Hi, everyone. My name is Isaac. I'm a first-year medical student. I go to University of San Francisco, California, so UCSF School of Medicine. And I have aspirations of going into anesthesiology, but I'm still early. So my primary aspirations are anesthesiology.
Great choice, personally, not biased at all. And before I start asking you some questions, just so everyone can know, you are welcome to submit any questions at any time. We'll have a Q&A section at the end, though, dedicated to that. So Isaac, tell me, what is a typical day for you? What kind of activities do you do? What was the workload like?
Yeah, absolutely. As an M1, a lot of the stuff that you're going to do is bookwork. So usually in the first 2 years of medical school, you do a lot of in the books type of work. So for me personally, I attend class Monday through Friday. And for UCSF, we're on a block-based schedule. So that means that we go to school based on blocks. So we'll have like a respiratory block, a cardiac block, like a neurology block. And so I normally structure weeks. So about 2 days out of my weeks, we'll have what's called academic obligations from anywhere from 8 a.m. to 5 p.m. And that's usually just a mixture of either lectures or small groups or labs. So for example, we may have morning lectures and then we'll have afternoon labs, or we may have morning small groups and then afternoon lectures. And then usually one day we'll do research. We have in our curriculum, we have research time implemented into the curriculum. So we'll have either research in the morning and then skills days where we do clinical skills and practice patient interactions. And then for the 3 other days during the weeks, we call them half-day obligations or half-day academic obligations. And so that means that we'll have either morning lectures or we'll have afternoon lectures or morning small groups and vice versa. And then the rest of the time is ours to do whatever we want with it. And so usually I'll either work out or I'll do some self-directed shadowing time, but usually it's studying. So there's a lot of time where the curriculum will have time where we can carve out study time or self-directed shadow times. And so that's why we have it like half days. But that would be a typical week for me personally as an M1. Next slide, please. And then what I wish I knew before medical school. So just to preface, I was not a traditional student. I took some gap years. So I took 3 gap years before I started medical school. But it's easy to say that medical school is a lot different than undergrad, or a lot different from the way you study in college. So I think one of the things that I wish I knew is that it's okay not to just change your study methods when you get to medical school, but even change up your study methods even when you're in medical school. So for example, the way that I study anatomy may not be the same way that you study microbiology, and it may not be the same way that you study neurology. And so to be adaptable is something that I kind of wish I knew before going in, just because the way that I did it in undergrad is I would just go to lecture, I would study the PowerPoints, and then you would take the test. But in medical school, you kind of have to be a little more adaptable since you've never really studied medicine before. The second thing is when you get to medical school, or even before you get to medical school, you'll realize that there's a whole bunch of different resources that students will talk about, whether it's pathoma or sketchy or first aid. A lot of students will use Anki, which is like a card deck that people will use to study. It's okay if you don't have to use all of those resources, because sometimes it can be resource overload. So I wish I kind of knew that I didn't have to use all of those. And again, it just kind of goes back to doing whatever works best for you. The third thing is when you're on the medical school track, or even when you're in medical school, a lot of students have this ideology that you have to get it all right the first time, or you have to be perfect the first time. And that's so not true. You're in school and you're there to learn. So it's okay if you don't understand information, or if you don't get it right on the first pass. That's totally okay. It's meant to learn. It's meant to make mistakes, and you should embrace the fact that it's a learning environment. And then the last thing is, and I got this advice on my interview trail, is medical school is incredibly demanding. It's a lot different than what you've ever been exposed to before. And so it's okay to take time to yourself and take breaks and to do things that you enjoy. So as I highlighted in my slides, don't lose your non-physician self. So if you like to work out, if you like to go on walks, if you like to play sports or basketball, it's okay to do that. And the goal is to take care of yourself so you don't burn out. And those are kind of things I wish I knew before, because I think there's an ideology that medical students are studying all day, every day, 12 hours a day. And I think it's important to not only study, but also to take time for yourself so you don't burn out. Next slide, please. Some of the advice that I would give to future applicants, people that are kind of going into the medical school application cycle, is that there's a lot of things going on in the application cycle, whether it's primary applications, letters of recommendation, secondaries, interviews. And you're bound to have questions. So whenever you have questions, don't be scared to ask them. It's okay. A lot of people have questions. And so I think the most effective thing that you can do is to ask whenever you have questions. And then the second thing is to try and be as organized as you possibly can. And that kind of means like figuring out who your letter writers are going to be, or start early with your personal statement, and not to leave all of that stuff to the very end. So you're kind of scrambling. And then the third thing is, don't underappreciate the value of your activity section and the personal statement. It's very common that a lot of people get really, they get really held up on the metrics, like your GPA, your MCAT score. But like a medical school application is more of like a story. And so you want to be able to highlight those things that make you unique in those activity sections in your personal statement, to kind of tell medical schools why you would be a great addition to their medical school. The next thing that I would say would be to respect each part of the application process. So for example, if you get the MCAT score that you've always been hoping to get, that's okay, that's great, good for you. But don't forget about the primary applications, the secondary applications, the interviews, right? So you want to kind of respect each part of those and kind of take time and do your due diligence to try and do your best on each part of the application. And I think and then the last one kind of goes to applicants at any level, is that the medical school process can be very long and it's very competitive, and it can be a roller coaster. And so you're going to have things where you may not have done well in a course, or you got a bad grade, or you didn't get the MCAT score that you want, or you got waitlisted to your favorite school. It's a roller coaster, right? And so I think it's important to remember that, and to kind of stay the course, and to kind of have things that motivate you for why you're wanting to go to medical school. Next slide, please. And then the advice to people after you've been accepted, the best advice I can give you is, when you're picking out a school of where you want to go, is to go where you'll do well, right? And so obviously there's a lot of things that go into picking a medical school, but I can't stress enough to find a school where you feel comfortable and to go to a school where you feel like you can do your very best. And then prior to starting my M1 year, I think it's important because you have this ideology where you feel like you have to be completely prepared to start and you have to kind of know everything from undergrad that you learned. And I think the most important thing that you can do before you start is take time to yourself and to do things that you enjoy. Just because in medical school, you're extremely busy. And so to have either the family time or the vacation time that you wanted to have is really important, because as you go further into your medical training, you don't have as much free time to do some of those things. And it's okay not to, as I said earlier, it's okay not to remember exactly every little minute detail from undergrad, because odds are you'll probably see it again in medical school, and that's totally okay. Like I said earlier, it's a learning environment, and so you're there to kind of do your very best and to learn all of those things. And then lastly, and this kind of goes to imposter syndrome, which is kind of common amongst medical students, is to remember that when you do get accepted to medical school, your school particularly chose you. And so they believe that you can do it, and they believe that you've put in the work to be a good physician, and to remember and to embrace how different medical school is from undergrad. And the goal there is to just learn as much as you can so you can better take care of your patients.
Thank you, Isaac. I think that was a great insight into what it looks like to be an M1. So next up, we have Colin, who's an M2 at the University of Wisconsin, and he's going to tell us a little bit about what it looks like to be a second-year medical student.
Good work, Isaac. Good to follow up on you. So, yeah, I'm Colin. I'm from Montana, but grew up in Missouri. Second year at University of Wisconsin now, and I'm actually calling from one of the on-call rooms in the hospital. There's like a bed next to me. So I'm on my clinical rotations now, and I did the first semester of last year was preclinical, what Isaac was doing. A lot of schools will do 2 years or a year and a half of preclinical. So I'll talk a little bit about both. So you can go ahead and go to the first slide here. So yeah, I'm 4 months into my clinical rotations now. I'm actually usually in Madison, Wisconsin is where the University of Wisconsin's at. And I'm in Milwaukee right now doing an away rotation. So some schools will send you off to a different city for different rotations. And I'm in like kind of like a downtown Milwaukee hospital, but I put a picture here for you guys to look at the University of Wisconsin hospitals. So a lot of med schools are affiliated with a big academic center, like you'll be, basically like a city of healthcare is what it feels like sometimes. But as a second year now, I show up to the hospital at 7 a.m. and then I get up at 6 and walk to the hospital. It takes me like 5 minutes from where they gave us some student housing. And then like 7 a.m. to 8 a.m. you pre-round on patients. So like I bet your M3s, M4s can say a little bit more about this, but you usually have like 2 patients and you kind of look at the notes on them, and then around like 8 a.m. I'll like go actually see the patient and like do a physical exam and like listen to their heart and lungs on my own, and then kind of come up with a plan for what we think we could do with the patient. So, and then around like 9 a.m. we'll meet the attending and then go with the whole team, and you like usually present the patient. So today I have 2 people with heart failure today, or one of them's got like chronic kidney disease, one with heart failure. So looking at how to like get some of the fluids out for them. So that was kind of my day. And then this afternoon, I around 3 p.m. I had like a GI like didactic. So like we went through a couple of cases. So then that's what a lot of Isaac was doing. Like first year, you sit down like a small group and do cases with your classmates, and we'll do that about 5 hours a week. Now that I'm doing clinicals, and I guess my thoughts about clinicals now is it's a lot less flexible. I think a lot of schools, like you'll be able to tune in online like we're doing now, and like you can watch recorded lectures and that type of thing. But once you're in clinicals, you have to be at the hospital, So And right now my rotation is 6 days a week. So it's tough, like not being able to travel or get a full week and I go see family or whatever. But over Easter weekend, I had one day off and I drove pretty far to made it work. But I'll say like, even as a second year, you'll get a way more opportunities than you expect in your clinical rotations. Like I finished OB-GYN and pediatrics and like I was doing pap smears and you're there delivering babies and you're doing stitches for C-sections. Like you're going to be responsible for people pretty quick. If you're an M1, just be ready to know like you're going to be put to the test pretty quick and like making clinical decisions. Like you'll pick something up like today, like if I'm looking at a patient, I'll see something that the attending might not have seen, or you have more time with each patient too. And at this stage of med school, that you'll pick things up and you'll really be able to make a difference. And you can like research medications that other people don't maybe have time to look at side effects. So I think it's a pretty exciting stage of med school. The other thing we're kind of focused on is like second years and early on in clinicals is shelf exams. And University of Wisconsin is weird. We don't take step one until after a year of clinicals. A lot of schools are different, but we're taking like a shelf exam is like the step two equivalent. So it's like clinical decision making, and you'll have to study like after you get home from the hospital with your clinicals. So that'll take up like a lot of your afternoon sometimes. And then like the week or two before the shelves is really like when you have to pick up the studying and like stay up late or find that extra time. But then most of the other clinical time you'll once you have your evening, like you can enjoy the evening. It's kind of been my experience. And then as was talking about study resources like Pathoma and Sketchy, First Aid, and I think those are more of like preclinical resources, and I definitely use some of them in like boards and beyond. But for clinicals and shelf exams, you're going to use more of like UWorld and AMBOSS is like something that these are things I'm using, and you do just a lot of practice questions. So if you're taking the MCAT, the UWorld's something that's done, or like taking the AAMC tests, like just do a lot of practice questions has been my experience. And then like as you have a patient that comes up, you can study like the illness that they have and like use it to make a decision like in real time, but also you're studying. So that's been kind of like the academic side of second year med school for me. And you can go to the next slide and I'll talk more about like the lifestyle and like how like the first year when you're in preclinical most schools, you're going to be around a ton of classmates. And I guess it's during COVID mostly for me, but everybody's in the same place. And you'll get to know like all these different people, and it's like pretty incredible to see where everybody comes from. And like I think your first year you should like really take advantage of that. Like, and we had like a volleyball team and a basketball team, and then we had a competition between the med school and the pharmacy school. That was like, yeah, we play all these different sports and different trivia nights and stuff. That I think you won't really get the same amount of time to like appreciate that as a second year. As a second year, I'm interacting more with like residents and like hospital staff. You're not really with the other med students as much. So that would be my tip: is enjoy the time with your M1 classmates or preclinical. So I put a picture here of the Monona Terrace in Madison, and so we have a med school gala planned for next month, and so we didn't get to do that the first year when I was there. There would usually be like a big dance between the med school and the law school, but we couldn't have it. But now we're having the dance next month, and the med schools, there's usually a lot of resources to be able to put on events, and a lot of really motivated people that you can plan things like this. It's really fun. And then, yeah, just my other tip here, I'll wrap up, is that in clinicals, you're going to be bouncing around like once every couple of weeks, or I'm on internal medicine now, so I have a month at the hospital, but you're going to be seeing new people. There's just a ton of turnover, and you have to be flexible, and you have to know how to introduce yourself. That'll be maybe my main tip is like when you're in a room and you don't know anybody, like you have to introduce yourself. And then the other tip for M1s is like, these things seem like really rare or really vague, the things you might come up in the lectures, but at the hospital, like really rare things come up all the time. So I think it's worth investing in that preclinical curriculum. That's all.
Thanks so much, Colin. That was such a great overview of what second year is like. I think an exciting time in med school is always when you get to start to see patients, which is, I think, why a lot of us chose to go to med school. So next we'll have Stephanie talk about what third year is like. You're already more than halfway done. So Stephanie, take it away. Tell us what life of an M3 is like.
Awesome. Thank you so much. Hi, everyone. My name is Steph. I'm a third year. Well, now I'm actually at the end of my third year. I go to school at UCLA. Our curriculum is a little bit different. And our third year is a little bit shorter to give us more elective time in fourth year. So I'm actually in my dedicated period right now studying for my step 2 exam, which is very fun. Just kidding, but it's something that you have to do. And then I'll be starting my fourth year. So I finished all of my rotations. I'm interested in internal medicine. And during my third year, our rotations were a little bit more compressed. So as a result, it was like very fast paced, learning on your feet, getting studying in when you could. Next slide, please. So for me, you know, it's really difficult to really give a daily routine of third year because it depends on the rotation. But I'll just go through a couple examples. So when I was on surgery, so I started off on surgery, which very different from your preclinicals. So I have a couple tips for that. First, I use this app called Touch Surgery, and it was phenomenal. It's a free app. And so what I would do is the day before, I would ask my resident, you know, what surgery was going to be on the schedule for the next day, or multiple surgeries. And then I would, you know, kind of read up a little bit, review any anatomy that I might get asked about. And then I would go on Touch Surgery, and then it walks you through step by step what's happening in the surgery. And that really helped me prepare. Also on OB-GYN as well. I really found that to be helpful for the anatomy too. So that's something that I use. For surgery, it depends also on which surgical specialty or whether you're on gen surg. Some of the days are very early. Sometimes, you know, I'd have to be there at 5:30, depending on what time your rounds are. And a lot of times surgeries are starting at 7 or 7:30. So, you know, my advice is just give yourself enough time, especially in the beginning, to be able to pre-round on your patients. You're going to want to review labs and imaging and make sure that you're really well versed on that. And your intern and the other residents will definitely help you. But, you know, we learn this way of giving a presentation in our preclinical years, and it's a little bit different on some of the rotations, and especially in surgery. So, you know, you have to learn to adapt and be flexible because sometimes you have to give a little bit of a shorter presentation. So, yeah, so typically I would get to the hospital around 5:30. I would round on my, you know, 2 or 3 surgical patients, see how they're doing. Physical exams really important here. You want to make sure if they've had surgery, how's their, you know, how are they doing? How does the incision look? Are there any signs of infection? All of those things are really important. And you're really wholly responsible for these patients now. So it's a lot different than learning about the pathologies, you know, during your preclinicals. Then you usually do walk rounds with your team, which may or may not include the attending, depending on the day. And then if it was surgery, I'd be in the OR at around 7:30, getting scrubbed in, getting ready for the surgery, and then kind of in surgeries all day, depending on what the specialty was. And then after that, in the afternoon, sometimes I would help the intern out, go down to the emergency department if there were any new cases that came in that might need to get worked up. And that was kind of the flow of the day on surgery. Internal medicine, a little bit different. So we have sign out from the night team at around 7. So I would get there a little bit before then, make sure I was there to, you know, hear from the night team how my patients did overnight. And then from like 7 to 9 o'clock, I usually had around 2 hours to go check in on my patients, prep my notes. And then depending again on the attending, we would either do walk rounds at 9 where we walk around the hospital and see everybody's patient on the list, or we do what are called table rounds where you sit at the table and talk about your patients. So it's really attending preference. And then pediatrics, neurology, even psychiatry have a very similar format to internal medicine. So once you get the flow of one specialty, it kind of carries over. For me, UWorld is critical, and I also thought that AMBOSS was really, really important too. I tried to use flashcards as much as I could, but you'll see you're very busy in third year, so it's hard. So just get it in when you can. Sometimes, you know, for surgery, there's a lot of downtime in between surgeries, cleaning out the OR, getting the patient transferred. So if I had time when I was sitting around for 20 or 30 minutes, I would use that time to answer some questions, read up on pathologies, and that's kind of how I prepared for my shelf exams. Things I wish I knew. Know your EMR system. It's so critical. So ask your residents for tips. How do they, you know, we use Epic. So how do they organize Epic? All of that is really critical. Get your templates ahead of time so that when you're writing your notes, you don't have to be scrambling. It's a lot, but it's good to remind yourself that everybody started at the beginning at some point. And so everybody has walked in your shoes and understands what you're going through. For surgery specifically, know how to scrub, practice your suturing skills as much as you can, especially if you're interested in surgery. Those things go a long way and really impress both the residents and your attendings. I would say, don't be afraid to step outside your comfort zone. You know, you're a med student, but you're a person too. So, you know, think of yourself as really being a part of the team, and you're working amongst colleagues. So if you see something or you have something that you want to add, you know, like Isaac was saying earlier, you're the one spending the most time with your patients. So, you know, make sure that you really bring that to the table, and tell people things that they may not have noticed about the patients. Your patient's best advocate. And then lastly, if you have time to give like a mini presentation on your rotations, I think that is a really great way to kind of impress, especially if has to do with a patient that you saw and you were like really interested in like the pathologies. So that's like something else, just like a little nugget if you have time. So things that I would have done differently, just trying to get through more studying, studying on the go. And then in terms of other advice, so know the dog's name. This is something that my preceptor told me when he was in med school. You know, he was trying to get all the labs and everything down so much. He went back and he gave this like really great presentation and he was so happy with how it went. And the doctor just said, okay, like that's great, but what was the patient's dog's name? And he was just like, oh, I didn't get that. And you know, it was kind of a lesson of, we can get so focused on the numerics and trying to finish our notes, and that's great. And you're going to be doing that as a resident, but you also want to get to know your patient, learn those stories, learn more about their life, because now is the time to be able to do that. So I think, you know, don't forget that during your third year. I'm really big advocate for wellness and exercise. So I tried to move my body in some way every day, whether it was like yoga, stretching, biking to work, or running after work. That was really, really important for my mental health. And then just trying to get as much sleep as you can, even if it means sacrificing studying. I think at the end of the day, being well rested for your rotations is way more important than trying to cram something in last minute. So yes, that was a little overview of third year. It's a lot, but I believe in you all. Thank you.
Thank you, Steph. That was super helpful, and definitely some things I'm going to write down as I start my third year this summer. But our last panelist is Troy, who's a fourth year at the University of Colorado. It's kind of exciting. He's the one who's gone through all 4 years of med school and, you know, has all the advice to give. So we're excited to hear from you, Troy.
Yeah, it's funny. I actually don't have much to say else other than what everybody has already said. And so I'll just be kind of echoing that. You can go ahead and hit the next slide, please. So this is sort of a little bit of my story. in that I grew up in Lindenhurst, Illinois, a small suburb outside Chicago. And then I went to Washington University in St. Louis for college. And there's my younger brother in both pictures next to me. If you hit the slide button once, I just wanted to point out he got much heavier. And then I am now a medical student at the University of Colorado. And that was a picture from my first day of medical school, and then a picture from my first day of the sort of clinical year. And now I'll be, I guess, a doctor in 2 months, which is really scary. And I hope that I can provide a little bit of sort of the longitudinal perspective, because talking about the nuts and bolts of fourth year, I think is a little silly because it's so different. It will be so different by the time you guys get there. And so aside from, or sorry, you can hit the next slide. Aside from not knowing what to do with my hands, I hope I can give you guys some perspective. So this was my preclinical schedule, in that at our institution, we had a little bit more flexibility in our schedule, and we sort of would have 8 to noon or 8 to 1 lectures specifically. And then you were sort of able to fill your time as you saw fit. And so if you tap it once, that's going to be my sort of how I slipped out my AMs, was I'd bus to school, workout, and then dash over to class. And then if you hit this slide another time, like all good med students, I found a lot of different ways to fill that free time. Importantly, ending with Netflix and ice cream. Next slide, please, for my clinical schedule. Our clinical schedule is a little bit different at the University of Colorado in that instead of having sort of block curricula, we sort of tease out sort of our curriculum in a longitudinal sense. And so I had internal medicine clinic, for example, Monday mornings. And without getting into too much detail, I just wanted to point out that the times are actually quite similar to the times that you spent in your preclinical time studying. The big difference, I think Colin pointed this out, is that the flexibility is just kind of the big difference between the two and sort of needing to be sort of at clinic or at the hospital. But I will point out that Netflix and ice cream is the one constant, or at least it was for me. And so then you can hit the next slide. And I think this is the most important thing that I could think about giving you guys advice as you're looking to apply or maybe interested in medical school, is that you will be around just the most fantastic and wonderful people who will continue to inspire you. So you can go for hikes with them, Zoom study calls, foster a dog, advocate inside the clinic, advocate outside the clinic, hosting ski days, grabbing PB&J, and then going for hikes together, and most importantly, making your mom proud. And I think to actually answer the questions that I think that we were given, what I wish I knew, and Isaac already answered this beautifully, I wish I knew that it was okay to not know things right away, and that in medical school, as you'll see, Isaac and Colin is probably already seeing, it's you get a chance to see things over and over and over again, like heart failure, kidney failure, and sort of you're adding new layers of nuance and learning to each of those things. And so realizing that it's so much more of a marathon than a sprint, I think. And I think the last thing that I would say is what I wish I knew was sort of that it was okay to say I don't know a little bit more, and that it's so important to come into medical school as your whole self, and leaning into sort of the people around you, because there are so many incredible people that get into medical school. And so I think leaning into that is just the answer. So that is my very short and sweet way of presenting perspective from a fourth year. Thank you so much.
Awesome. Thank you so much, Troy. That was such a great way to end. It seems like you had such a great time all 4 years of med school. And I think you had some really good advice on just making sure to take it all in, because it really does go by super fast. We're going to go into our Q&A section now, and we will start with the first question, which is for Isaac and me. I also have an interest in anesthesiology. Did you emphasize your interest in this field in your application? And if yes, how did you talk about this interest? So I can just go real quick. I did not know I wanted to do anesthesiology when I started med school. So I think it's very early to be thinking about specialties. I promise you will probably change like a million times. I changed at least, I think I came into med school wanting to do OB-GYN, and obviously that did not happen. So I don't think you need to worry about that. I think on your application, focus on, the things that make you you, and trying to find the best fit that you can at the right school, because I think that matters more than anything. And finding your specialty, that'll all, work itself out as you go throughout med school. Isaac, feel free to add.
Yeah, I probably would kind of echo what Leanne said. You're so early in your training and it's likely to change. So I probably wouldn't really talk about the specialty that you really want to do, just because it's, like I said, it's likely to change. One caveat that I would probably say is if you're really interested in primary care, some medical schools really make their mission statement primary care based. And so if you can find ways to incorporate how you would want to do primary care, your passions for primary care and community medicine, that's probably the only thing that I could probably see picking a specialty and kind of thinking of and adding it to your statement. But other than that, I probably would stray away just because it's likely to change.
Thanks for sharing all. That's definitely helpful perspectives to have. So the next question we have, we'll let anyone really answer, but how do you make yourself stand out in the application process? A lot of applicants who are applying to med school have good GPAs, have good test scores. How do you stand out? And is there anything you would recommend a pre-med do before submitting their applications or getting involved in kind of in their pre-med years?
I could start this question off, and it's challenging just because, like Claudia said, there's so many great applicants, and there's so many different things that you can do, whether it's gaining like work experience, like becoming a scribe or doing research or shadowing. I don't necessarily think it's whatever it is that you're doing. I don't think it's the specific thing that you do. I think it's what you gain, like what you get out of that experience that will make you competitive, if that makes sense. I think if you have like good experiences shadowing, or if you had good experience like as a scribe or your work history, I think it's just kind of what you get out of your experiences and what you can learn from those experiences that would make you a better medical student and a better doctor. I think that's what's most important. And they kind of highlight that in the application where they ask you like, what's the most meaningful experience? It's kind of teasing those experiences out. So again, I wouldn't do anything just to kind of check it off. I would do things just because you're passionate about doing things, and those passions would translate to just doing well in medical school and bringing those experiences and sharing them with your fellow students.
Yeah, if I could just really quickly echo exactly what Isaac ended on, was that this idea of picking something that you find purpose in and passionate about, because ultimately in the medical school sort of application process, you're going to go to an interview and someone's going to ask you point blank about that experience and sort of how you talk about that and how excited or like not excited you were, or like if you even remember it. I'm just not a good enough liar to sort of fake my way through it. And I think that leaning into what you find purposeful is absolutely the right answer, because if it's not a good fit for that medical school, maybe it's not a good fit at that particular school. Or maybe there's another school that really values the community service work that you do or something along those lines.
Perfect. Our next question is, what do weekends and summers generally look like for you guys? Do you think that you could work part-time? And so maybe Stephanie, Colin, you guys can have some input since you've seen the different workloads throughout the years.
Yeah, definitely. So in terms of, for us, our summer, it was a little bit shorter between year 2 and year 3. We had like about a month or 6 weeks off. And then we started our 3rd year. Between 1st and 2nd year, we had more of like a normal summer, although nothing was normal when COVID was in full swing. So it was an interesting time to be in school. And then now between 3rd and 4th year, because it's elective time, you kind of choose when you want your breaks. And then in terms of being able to work part-time, I would say in the traditional sense, working at like a location, no, that would be very challenging, because of the hours and the demands. However, I work as a tutor at UCLA. I have friends that do advising as well. So things that you can do remotely on Zoom that maybe only take a few hours or less than 10 hours of your time per week, you could definitely do and definitely make that work. You just might have to sacrifice a couple other things in the meantime, like working out sometimes, which is hard because I like working out. But yeah, so I would say in terms of those two things, yes, you could work part-time if it's flexible.
Yeah, I can follow up on that. I think I know like 2 people in my class who like hold down jobs, or one person, she does like part-time EMT on the weekends or something. I wouldn't recommend that. Like, and some people, yeah, they'll do like tutoring for a couple hours a week, or like teach an exercise class or yoga class for like a couple hours a week, but something minimal would be my like recommendation, or what I've seen. And then other people, or I guess for the summers, I'll mention this: between the first year and second year at the University of Wisconsin, we get 3 months of summer, but almost everybody does research, and it's like a 20-hour a week kind of commitment, and we get like a stipend. I thought that's kind of a good balance, where you still have a ton of free time, but if you're a med student, you can't go like 3 months without like working, right? Like you kind of get a big kick out of working. So yeah, a lot of people continue that research through their second year, and so that'll kind of be your part-time job in my mind. If you're a med student, you'll get some payment for being like a research or writing papers, and that'll be maybe more helpful in the long run than like making a couple extra dollars on the weekend. That would be my experience. But then, yeah, as far as like weekends go, we also get like a spring break our first year. People, you take your vacations, and if you want to have fun 2 nights on the weekend for my first year, like I made sure that you can definitely be social and join like a club sport or something. Like on the weekends, definitely possible. And then usually like Sunday evenings, I would study for a few hours and then take a quiz like Sunday evenings. So yeah, you'll find a balance somewhere.
Thank y'all for sharing. I think those are great perspectives. Now that the culture of interviews for med school has kind of shifted to an online format, or a lot of interviews are happening virtually, how would y'all recommend that people kind of get to know the culture of a med school outside of just like the academics that are reported online, or just kind of get a feel for that community that especially you talked about, Troy? Like, how would you recommend students learn about that or get a feel for it?
I can start, but I think the folks who applied when interviewing over Zoom will have a much better perspective than I will probably on this. Having recently applied to residency through a virtual interview cycle, I can speak, I think, a little bit to it. But I think it's a little bit of a different ball game. I think that for me, what it was with Colorado was just meeting people who are humble and down to earth, and seeing the ways in which they interacted with one another, both the students and the staff. And I thought that was really, really special and unique. And so I think seeking out opportunities where you get a chance to do that, whether it's just reaching out to like a medical student, prospective student representative. Oftentimes they'll like make themselves available, and it's kind of scary to send an email and you're worried that you're being assessed, but oftentimes you're really, really not. I think that's reasonable. And I also think that more and more second look days are tending to be a little bit more in person and tend to like not be at all evaluative, especially after people are accepted to medical schools. And I couldn't recommend sort of those activities more than enough, because that's sort of the thing that swayed us. But I'm curious if anybody else has like any other perspectives.
I echo everything that Troy said, and if you are really interested in a specific school, find students on the website for the medical school, on LinkedIn or on Twitter, and don't be afraid to reach out. We're all so invested in this career. It takes years. It's a lifestyle. It's a total emotional, spiritual, physical investment. And so we want to help everybody else as well. And so if you demonstrate that interest and that passion and you want to know more, for my personal experience, we're always more than happy to provide more information as well. And, if you have something, so for me personally, I'm really interested in integrative medicine, which encompasses nutrition and Chinese medicine, and UCLA actually has a program that does that. So I tried to find like-minded people and hear more about that, and that was kind of my motivation. So, at the end of the day, my best advice is don't try to fit a mold. Find what you like and then, you know, really dig deep into that, and the place will find you. You know, it's a square peg isn't going to fit in the round hole, right? That's a very famous saying, but it really is so true. So that's my best advice for you.
Yeah, I definitely know that the virtual interviewing process has been very different, and I'm not sure what the next, you know, couple application cycles are going to hold, but I think Stephanie and Troy all brought up great ideas and things to keep in mind. Our next question is, so with med school, it seems like it's very different from college in that they're not just classes, you're doing a mix of clinic, research, you know, some classroom in your first year. So can you guys talk about how were you guys evaluated and graded for each of these? And, you know, we all know it's very hard. So what happens if you don't necessarily do your best on an exam?
I can speak about this because I'm just kind of getting my first like clinical evaluations back. And I'll say, yeah, like in preclinical, you take tests and then you also have OSCEs. I think every school probably does this. I think it's required. Like, so you go into a patient encounter with an actor, and you're like videotaped, and faculty record your interactions with patients with actors. I think that's something I didn't really know about that much when I was applying. And then in clinicals now, we're evaluated based on like 4 different ways like how we interact with people, and like so we're graded on like our presentations of a patient. Like you there's a very specific format of how you're supposed to present a patient, and faculty, after you spend like a few weeks with them, will say like, oh, this person gives really effective presentations, they're organized, that type of thing. And then you also get graded on like your clinical knowledge, so if you can demonstrate in your presentation that you know what's going on. And then you're also graded on like your communication skills and teamwork, so they'll like kind of check a box like, oh yeah, this person knows who to communicate with and when. And then there's like an algorithm, like if you check enough boxes, like, oh, this person's a good communicator, good presenter, good clinical skills. And then they can also grade you on like your like physical exam skills. Like, does this person know how to tie knots? I haven't done surgery yet, but I think that's kind of how it goes. So it's not as much on the test. And then you also take the shelves though. But we're kind of graded on how you interact with people and how you present, which is interesting. And if you fail a test, you can retake it. Sorry.
No, I can kind of add as an M1 from Colin's point of view. We here in my medical school, we do the identical thing that he does. So basically, at least for your first year, you're going to be taking a lot of tests just based on organ systems. So you'll take anatomy exams, you'll take like exams over the kidney, over the brain, over the lungs, and then you'll have the clinical based exams where you'll be recorded. You'll do a physical exam, you'll do a history, then you'll present. And you'll get evaluated that way. A lot of the medical schools now are pass fail. So it takes off the stress a little bit, but you're still being evaluated. And so those are basically the exams that you get. And then you study as counseled for the OSCEs, which is just the clinically based exams that you'll take in addition to the science exams that you'll take in your preclinical year. And then you'll move to the clinical years, and then you'll take different your self exams.
And then really quickly, just to add in there for us, years 1 through 3 are pass fail. And then our 4th year is graded. And so in terms of things that get submitted, your STEP scores will get submitted, your 4th year scores will get submitted, your 4th year grades. And then, you know, schools will just see that you had a pass on everything before that. In terms of remediation, you know, that varies depending on the medical school. UCLA is really flexible. If for some reason you had a conflict come up, an illness, you had to, you know, wait and take an exam later on, you can do that. And none of that is ever reflected in the final score. If you, for some reason, you know, don't pass a shelf exam, we can retake that exam at a later time. And again, that wouldn't show up on our transcript. So what I've seen is that a lot of times it really is flexible. They want you to succeed as a medical student. So that's always very reassuring, and, you know, really puts the focus on learning for the sake of learning, which I enjoy.
Thank y'all for sharing. Our next question is kind of about mentorship. So both applying to medical school and then within medical school, was that something that was provided to you, or how did you go about finding a mentor to kind of help you through all the different stages of your process?
I guess I can just start on that one. Sorry, I've been talking a lot, but so for me, I found what I was interested in. So, my integrative medicine interest, and then I basically like went to that center. I asked if any doctors were working on any kind of research projects. And so that's kind of how I met my mentor in medical school. Our med school also sets us up with mentors based on a survey that we fill out. And I think a lot of other schools probably do something similar. But if you know that you're really interested in cardiology or hemonc, just go on the school's website and kind of look up those doctors. Or even if you had an amazing lecturer, reach out to that doctor, see if they're working on research, see if they would have you come in and work with them in the hospital. A lot of my friends, one of my friends that was interested in emergency medicine, she did that, got to work with her preceptor, now is doing research projects, and actually designed like a special elective in her 4th year. So again, there's really a lot of flexibility. Just take the initiative and jump in if you're interested.
Yeah, to really quickly piggyback off Stephanie's point, I think in medical school, the school really hopes and tries to support you as best as they can. And so finding mentors tends to be a lot easier once you sort of have your foot in the door. I think the trickier question is, how do you find good mentors to help you in your application process to medical school? And I think finding people that you know and that you trust and that know you well and can give you strong advice. And I think for some people, their like school might have sort of like a pre-med or like health professions advising system that doesn't typically, at least at some of the institutions I know of, close their door to people who've graduated in the past. And so something that you can sort of retroactively do if you've like since graduated from medical school too. Or sort of thinking about like the people who wrote you letters of recommendation tend to be people who know a little bit about medical school too. And so those would be sort of the first sort of buckets of people that I would think about as mentors during the application process that some of you might be like currently thinking about.
I'll add just a little bit too. Something I didn't realize was like how different the perspective is between like professors in undergrad and like the doctors who are going to be reviewing your application. Like med school, it's a lot different than taking like biochemistry. Like your letter of recommendation writers are like, they'll say how academically prepared you are, which is important. But if you can find a mentor who is like a resident or like a doctor, like an MD, like I feel like I didn't really have that very well. Like I shadowed somebody, but I didn't have a mentor who could like truly review like my medical like perspective. And I think when you're going through a personal statement and everything, like you might write something that a doctor would be like, that person has no idea what they're talking about. If you can get like a doctor to review it some way or another, I think that would be really useful that I didn't have.
This next question kind of focuses on different paths to medical school. I know some people decide to go straight through. Other people might want to take a little more time off and do these gap years. I would just be interested to hear if anyone either went straight through or took some time off, and your reasoning behind that, and if that, why you did that and how that impacted your experience in medical school.
I can start with this question. So as I said earlier in my presentation, I actually took a few gap years. Firstly, I worked as a pharmacy tech. I worked as a scribe, and then lastly, I worked as a paramedic. And I shadowed a whole bunch of stuff. But anyways, that actually was really helpful. Personally, I wasn't really ready to go to medical school right after undergrad, and that's totally okay. Some people go straight through, some people have more non-traditional routes like I did. But I do really think, and kind of going back to what I said earlier, I do think that my experiences helped me for medical school. For example, like when we're learning pharmacology, sure, everyone learns the drugs, but a lot of times like you forget of how much some of these medications may cost. And so as a pharmacy tech, you can really hone in on that experience and let your classmates know like, hey, we can prescribe all of these medications, but like if they cost so much, like it's gonna prevent the patient from being able to like maybe get the medications. And then as a paramedic, I would work a lot with not just the physicians, but also the nurses and the respiratory therapists. And so it helps a lot with interprofessional collaboration in kind of being able to communicate, talk to patients, talking to them in a way that they can understand what you're saying, and kind of just being comfortable in those interactions. And I said, a lot of people take different routes to medical school, but I think the big picture is to go to medical school when you feel ready. And sometimes you may never feel completely ready, but it's just to go when you feel like you can do your best, because I promise you, medical school is not going anywhere.
Yeah, I love that. And I'm someone who went straight through, so I'm happy to sort of provide the alternative perspective. And it's really the same. It's the same sort of advice that you should apply when you know that is exactly what you want to do, and you can kind of go in with your whole head and your whole heart. And I think that it takes someone with like maturity and sort of perspective to do well during the application process. And I think that the sort of like diversity of like life experiences is what makes medical school so unique. And I've learned so much from people who took gap years and what they did during those gap years. And I'd like to think that some of the experience I had like during medical school still helped me add a little bit of richness to sort of my medical school too. And so it's really a question of like how ready you personally feel in applying. And it's such a hard question to answer. And for me, the answer was like, I might as well give it a try. And so that's what I did and happened to get in.
Thanks for sharing. I'll kind of echo Troy. I also went straight through for medical school. I felt like me personally, I just wanted to keep going and felt like that was the best option for me, was to keep trudging on through. And it's ended up being great, but it's definitely what works best for you as an applicant. So kind of as we're wrapping up near the end, just reflecting on kind of where each of y'all are in your different journeys, but what has been either the most humbling or the most useful or the most memorable lesson you've learned during your time in med school?
I'll start and I'll try to be quick. I love this question. I'm reminded of a patient encounter that I had that was extremely humbling. And I had recently taken a motivational interviewing course, and my preceptor was coming in to sort of evaluate me on how I was like interacting with the patient in a sort of motivational interviewing sense. And I was like, oh my gosh, I've like got all of these like one-liners in my bag ready to go, and I can't wait for this. And so I walked in the room and like had a conversation with this person for about like 2 minutes. And I said, I think the quote is, you really care about your health. And both he and my preceptor just started laughing at me, like just like through the roof cackling, because I was so wrong. And he had been sort of like intermittently seen in care, and like personally had like just started to like attend appointments a little bit more consistently. And I think for him personally, it was just like not at all like part of his story. And so the lesson for me there was that like all of these sort of patient stories are unique, and sort of to have a cookie cutter approach to an interaction and experience is just so far from the sort of the truth. And so even you can know as much as you can do all the classes that you want to take, but at the end of the day, it's still just about connection. So I'll be quick and end.
I have like 15 seconds here to say something too. Like, the most humbling part for me that I've just realized is that it really is like a long journey. Like 8 years is your commitment minimum. Like, you're gonna be there a long time, and you have to really love it. So
I would just say to always remember to be present and listen. There's always doubts in our head, things that we may tell ourselves, but try to just pay attention to what your patient is saying, what's presented in front of you, and just read the space. And that will really take you a long way, both within yourself and when treating other people too.
I think just a quick follow-up is that you're going to study a lot. You're going to have a lot of patient interactions. You're going to learn from a lot of different people, a lot of different healthcare professionals, but don't forget that you can also learn from the patients themselves too.
All right, thank you so much to all of our panelists. I think that is a great way to end our session. These slides will be available shortly after, and the recording will be available for the next 30 days as well. But thank you so much for spending a part of your evening with us, and we wish you the best of luck on your med school journey.